Hello everybody, welcome back to the channel. Today we are talking about the three main causes of knee discomfort that I see in the clinic. Now, it must be said up front that this video is for informational purposes only, so this cannot be seen as medical advice. If you have knee discomfort and you've had that for more than 2 weeks, it is time to seek out a medical professional. You can see a physician in your area who will refer you hopefully to a physical therapist, or if your state legislation allows you to, you can see a PT directly through their direct access laws. We are going to talk specifically about symptom control today, and this is why it's so important to see a medical professional for a full evaluation, because we are not going to treat range of motion, strength, motor control, or any other deficits that you might have in your body. This is purely turning off the discomfort faucet, if you will. So without further ado, let's jump right in and let's see how we can make our knees feel a little bit better. So we are going to talk first about intra-articular knee discomfort. So this is discomfort that is felt commonly along the joint line, which is right below the knee, and it can go on either side. Sometimes people find it more on the middle in the front of the knee. And what happens when we have like a large axial load, maybe you stepped in a hole or you fell from a height, or a recurrent axial load where you're doing lots of running and pounding on that knee, the cartilage can get upset, it can get red and angry and causes some discomfort. So what we want to do is, we've got our table here, and I'm gonna sit on top of that and dangle my legs off the top. If you don't have a table like this at home, you can use a desk or a bar stool, something that sits up high. And what we are going to do is just quickly and nicely kick our legs back and forth. What this does is it produces a low level cyclical load in the knee cartilage. On top of that, it also gravity pulls the shank of the lower leg down to create some distraction of those joint surfaces. It pulls those joint surfaces apart. And we want to do this for that intra-articular discomfort because there's actually a chemical pathway that is stimulated by movement, and that will help the knee by creating an anti-inflammatory effect. So much like you might take an over-the-counter anti-inflammatory drug, this can produce an anti-inflammatory effect locally in the knee. And if your symptoms are caused by inflammation, it should help your discomfort. Now, it should be noted that this takes thousands and thousands of reps. So when I prescribe this to somebody, I give them the exercise. I say do this 3 to 5 minutes, 3 times a day, and you will see over time that your symptoms will start to decrease. Now, the next diagnosis we're going to talk about, commonly seen in runners, is what we call patellofemoral pain syndrome. So this is discomfort felt on the tendons of either side of the patella, and we see this a lot either with jumping or running, and we just pissed off the tendon this time, not the cartilage. And we have 2 common kind of classic scenarios where people feel their discomfort with this. We have the moviegoer sign. So when you sit for a long period of time, your knee is bent, and then that creates some tension over that muscle, prolonged period of time of tension, and that can recreate the symptoms. The other thing we see is with stepping down from a tall stair. Again, creating that tension over the kneecap, and this time with a little bit of load because the whole body weight is on that knee. So now we see why that might hurt. How do we treat that? Well, the reason it hurts is the tendon is not strong enough to take the loads that we're putting on it. So maybe it might be running or jumping or stepping down stairs So we need to start to gradually increase the load capacity of that tendon. So what I like to do is utilize a step, and we're going to drive the knee forward over the toes, because this looks very similar to how we get our discomfort. We want to train as specifically as we can in order to have a result in the activity that hurts us. So how we would progress this is just using a higher step or adding some external loads. Keep in mind, if your symptoms are caused by running, you also need to do some level of hopping in order to gradedly expose that tendon to the kinds of loads that you're going to be experiencing during the activity that initially gave you some discomfort. Now, one note here, Knee Over Toes guys did a video not too long ago about the sled and how this activity really helped him with his knee discomfort, and this is the same idea, just a graded level of exposure to load to try and improve the knee's capacity to withstand that kind of load. And I think the sled is a great way to do that, just not everybody has one of those sitting around at home. The last diagnosis we are going to talk about is on the other side of the knee, on the back side, and this is going to be focusing on the hamstring tendons. So this typically happens when somebody is loading a lot of knee flexion. Knee flexion is where we bend the knee, and this can happen in running, this can happen in sport activities. So it is a very similar kind of idea where the tendons, the muscle is, it doesn't have the load capacity for what we are trying to achieve. And so the fix for this is very similar to what we saw with the step down, graded exposure of these kinds of loads. And so what we're going to utilize is an isometric. Isometric means a muscle activation where the joint is not moving throughout any range of motion. That's the iso, it's staying stationary. So let's say, for example, that my right hamstring, the one closest to you, is my side that hurts. So I'm gonna tuck my left in behind my right leg, and I am going to pull my right leg into my left that is resisting forward to hold an isometric contraction in the back of the leg. And we're gonna do this for about 30 seconds, 3 times, and that should help us to feel better in whatever activity we're trying to do. Now remember, we're just trying to turn off the symptoms at this point, and this sort of just helps us engage in more exercises that can strengthen the hamstring and improve the load capacity. So those are the 3 common knee discomforts that I see in the clinic: intra-articular knee pain, patellofemoral pain syndrome, and hamstring tendinopathies. We utilize these exercises all the time to help treat symptoms. If you found that you learned something from this video, please consider liking and following for more discomfort-related information. Thank you all for coming today, and we'll see you all in the next video.